I'm a pediatric urological surgeon, and I've devoted 32 years of my life to the study of medicine. It's not been easy at times, and at times I've questioned my ability or my conviction, but I've never regretted for a second my career choice. I get up every day and look forward to coming to work. And someone once said that if you love what you do, then you never work a day in your life. I've been blessed to have had many wonderful opportunities and experiences related to medicine, but it's been the interactions that I've had with my patients who are children and the knowledge that I've done things to make their lives better that has sustained me. But I'm standing here today sorry to tell you that what's good about medicine is close to coming to an end. The federal government wants to be my boss and decide who I can see, how many people I must see, where I can see them, how often, and more importantly, what I can do. They will decide what tests I can order, what surgeries I can do, and what medicines I can prescribe. This will be very bad for my patients. They will suffer when they have to wait 6 months to see me if, in fact, it's me that they're seeing or not a physician extender. They will suffer when they have to wait a year or more for an operation, provided that it is approved by a faceless national health board, which is already in place, having been formed under the stimulus package. It now awaits activation like a sleeper cell once a health care reform bill is passed. Patients will suffer when there are too doctors to take care of them and too few nurses and office staff to give them the high level of medical services that they've come to expect. We can't let this happen. I will do everything in my power to prevent this and to protect my patients from what they don't even realize is coming. Nobody is talking about the patients in this debate, and that's why we're here to represent them. I will not practice in a system such as the one that President Obama and the Democrats in Congress envision, and I'm not alone. 45% of my colleagues will do the same, according to Investors Business Daily. And this has nothing to do with money. It's everything to do with the government telling me what I must do and things that are inconsistent with the Hippocratic oath that I took when I graduated from medical school. President Obama has no problem asking us to ignore the first tenet of that oath, which is to do no harm. They want us to tell women under age 50 that they no longer can have mammograms, or women under age 21 that they can't have pap smears. And this is only the beginning. It's a window into the future of Obamacare. In Alberta, Canada, you cannot get a screening colonoscopy, and that will happen here. Screening men for prostate cancer will be the next to go. That's guaranteed. And I want to tell you that part of me here is to protect my rights as a patient. This rationing business is personal to me. My father died of colon cancer at age 62, so I get screened every 2 years. But I'm also a cancer survivor. I'm 3 years out from a radical prostatectomy and doing quite well, thank you. Under new government guidelines regarding prostate cancer screening, I would not have been able to be screened beginning at age 45 when that started. But imagine if someone like me, who has the world's knowledge of this disease at their fingertips, from a lifetime of experience, and who knows what treatment I want, by which doctor, at which facility, was told by a faceless bureaucrat that I couldn't have this, I can imagine it, because we are just 2 procedural steps away from this in the Senate. This nightmare scenario can happen. Can we allow it to happen? If these legislators were doctors, as you've heard Dr. Price say, they would be thrown out for malpractice. This has never been about health care to the Congress or to the White House. It's been about control. Control over you. Because when the government is in charge of the most fundamental need that you have, they've got you. But don't worry, because you can trust them. Stellar so smoothly and efficiently. Take Medicare. It's badly broken, and it's $38 trillion in the hole. But they want everyone on a Medicare-like system, but only after they trim $600 billion away from it and begin rationing care to seniors. They want to expand the disgraceful Medicaid system, which only 30% of doctors now accept, and this number is dropping every day. A system originally designed as a safety net for the poor to be extended to families earning $88,000 a year. This is a government that can't run cash for clunkers or a vaccination program. Do we want them to run health care for everyone? We formed Docs4PatientCare to expose these lies and to give everyone that they could stop Obamacare if they pushed back, and you have responded brilliantly. We formed Docs4PatientCare to give doctors an outlet because the AMA, which represents only 17% of the doctors in this country, was not speaking for them. We asked you to stand up and speak out in defense of your patients and your profession, and you have responded, but not enough. There should not be one doctor who really understands what we're talking about today who is not a member of Docs4PatientCare. We believe in healthcare reform, responsible healthcare reform. We know what they are. We just need targeted solutions. We don't need to pretend that the system is badly broken and needs to be replaced by a government coming to the rescue. People without insurance can be given vouchers to purchase it from one of the 1,300 existing companies. Or people can be given the opportunity to buy insurance themselves with pre-tax dollars like businesses. And in this way, they'll own their own insurance and it'll be portable. The high cost of insurance can be addressed by allowing people to purchase insurance over the internet and across state lines. Risk pools need to be expanded to include the entire country, thereby reducing risk and eliminating problems like pre-existing conditions or denying coverage because of high-risk conditions. And actually, as an aside, today Ben Nelson caved, and the reason why he caved is because he was given the promise by Harry Reid that they would get rid of the insurance company antitrust exemption that we fought so hard to get implemented. Consumerism should be encouraged by promoting health savings accounts, not eliminating them as the House bill does. People can become better consumers and make them responsible for spending their money on health care, and doctors and hospitals should be required to post their fees to make this easier. But most importantly, how can you have a reasonable health care reform debate without talking about tort reform? Costs associated with malpractice accounts for about $300 billion per year, two-thirds of which can be accounted for by defensive medicine. Imagine if we could save even half of this, it would cover pretty much everything that needs to be covered to fix health care. So what's the biggest lobby in Washington? Trial lawyers, no surprise. And 95% of trial lawyer money goes to Democrats. And Nancy Pelosi has rewarded them by writing a bill that takes money away from states that limit lawyer fees. To the best of my knowledge, no lawyer has improved the health of a single patient, yet they decide on what health care reform should look like. So I'd like to leave you with one of my favorite quotes from Thomas Jefferson. And he said, "A country that is big enough to give you everything that you need is big enough to take it all away." Call the key senators in Washington after this rally and tell them no on cloture. Don't let this bill come to the floor for discussion.